Unmute madam.
Video stop. Good afternoon, everyone. I'm Surya Lakshmi, physiotherapist from Maleshwaram Cloud9 unit. So today I'll be doing the prenatal fitness session for you all. And we also have Dr. Vanilla, who is the physiotherapist of Cloud9 Chennai, and she will be the answerer for this session. So once you start with the session, if you start getting any doubts, you can just jot it down, and then once the session is over, you can just answer it. Ask a question and she will be answering the questions for you. Okay, so we will be starting the session today. So it's not just about the exercise or the fitness part. I will also be talking a little about the ergonomics, which is the posture which you need to maintain during pregnancy. So during pregnancy, there are slight postural changes which occur in the body, but also we need to consciously make an effort to correct the posture. If not, it will lead us to some pains or aches throughout the pregnancy. So the first thing which we need to make sure is about the back posture. So we have a tendency to lean back because of the growing belly. We tend to lean back during pregnancy and walk, but we think that is normal, but that is not a normal alignment of the body, which can cause a lot of issues like back pain and also lower body pains because of the wrong alignment of the body. So the main thing we need to do is, so whenever we feel like we are leaning back and walking or standing, so consciously correct that, be aware of what posture we are having and correct the posture. So that is one thing which is very important. So that is one thing mainly which we have to follow. The second one is keep changing position throughout the day. So when you're sitting in a place, so if you're sitting on a chair or sofa or bed or wherever it is, you have to keep changing your position every half an hour at least. So minimum every half an hour you have to keep changing your position. More than half an hour, don't sit or stand. Maybe you're working in the kitchen, you're doing some household activities, keep changing your posture. That is also important. So keep changing position frequently while sitting, standing, lying down also. When you're not sleeping, don't keep lying down in the same place for more than half an hour. So that is about changing posture. Then the next thing is picking up something from the ground. So if you have dropped something down on the floor, or if you want to, there is something on the floor which you want to lift up or pick up, what you need to do is you need to always not go directly forward and pick up the item which is on the floor. You need to slightly bend your knees and then pick up the item from the floor. So this also you need to keep in mind. So many of us, we have a habit of directly bending forward and picking up things. So even if it is heavy or light, doesn't matter. You need to always slowly bend your knees and then only you need to lift up the item from the floor. Okay, and also coming to working women. So working women who are working maybe 8 to 9 hours or more than 9 hours during the day. So the sitting posture during work also plays a very important role. So how our posture is, that determines what kind of pains, aches we can get or we can prevent. Okay, so always you need to keep your back supported. So whenever you're working, maybe you're working 8 to 9 hours in a day, maybe you'll take around 2 breaks, maybe a lunch break and maybe 1 or 2 small breaks. So other than that, I want you guys to take few more 5 minutes break in between your work so that you will feel much more relaxed and you won't be always sitting in the same place. So whenever you cross maybe 30 to 40 or 45 minutes maximum, you need to take a 5 minutes break and then get up and walk around or do some other activity. Just go see what your family members are doing at home, anything like that. So just move around in your home or inside your room itself. Don't keep sitting in the same place. So that is about taking breaks during work hours. And one more thing is always keep yourself hydrated, keep drinking water. So keep a water bottle in front of you on your table wherever you're working so that you keep taking in water as you see the water in front of you. So that is also one thing which you need to make sure that you're doing. And whenever you're sitting, so even if you're working or not, whenever you're sitting on any chair or sofa or anywhere, you need to always keep your back supported. So always keep 1 or 2 pillows, support your back. So if your chair is not that good enough, keep how many ever cushions, pillows you want, and always support the back, and you have to sit. Because when you're working for a long time and you're not sitting in the right posture, definitely it will impact your muscles. So it will cause some muscle pains or aches, and then it can get aggravated if you're following the wrong posture throughout your pregnancy or for a long period of time. So coming to also the area where you're working. So avoid working, especially when you're using a laptop, avoid working sitting on the sofa or sitting on bed. Okay, so always use a table and chair when you're working. So supported chair, even if the chair is not good, support with pillows, and you have to sit and work. Make sure the monitor is right in front of you at an eye level. So you should not be looking up at the monitor or looking down, bending your neck, bending your shoulders. That again might cause shoulder pains. So always maintain a normal erect posture when you're sitting and working, and also let the keyboard be at good height. Okay, so you should have a proper forearm and a hand rest also. When you're using the mouse, when you're using the keyboard, make sure it is at a good level of your forearm and hand, so that you won't be compressing any of your nerves in the wrist. So that is one more thing which you need to remember. And also the footrest. So if you're hanging your legs down for a long time and sitting during work, it's important that you have a footrest. Otherwise, it can cause some swelling. So swelling is very common during pregnancy. So you can always use a footrest to rest your feet when you're sitting and working. Okay. So these are some of the few tips which I would like to give you about the ergonomics during pregnancy. So first thing which I told you was about the leaning back, which usually happens. So when we lean back like this, we are putting more pressure on our low back area. So we have to always correct that when walking or standing. So that was the first thing. And also keep changing your positions frequently, and always whenever you pick up something from the floor, bend your knees and you need to pick up, even if it is heavy or light. And also during work, keep taking frequent breaks. Drink a lot of water to keep yourself hydrated. And also during break time, keep moving around. Don't keep sitting in the same place. And have the monitor at the eye level, and also the keyboard and mouse at a good height, so that you are not compressing your nerves at the wrist. Okay. So now, and also the footrest, which you need to use if it is required. If your feet is hanging down from the chair, if your feet is not touching the floor, always you can use a footrest. So I'll just show you one more sleeping posture. So sleeping is a very big problem during pregnancy. So throughout your pregnancy, most of them feel difficulty in sleeping. So I'll just show you one good sleeping posture which you can follow. So for that, we have Shweta here, who's a psychologist here at Malleshwaram unit. She will be helping us out. So let's just welcome her. Thank you, Shweta, for coming. So she will be showing us the sleeping posture. So right now I have just placed a pillow below her head for head support. So if you want to sleep, so usually doctors say, suggest you to sleep on your sides, right? Rather than sleeping on your back. So whenever you sleep on your sides, it's a little difficult to sleep. So what you need to do is come to the side. So everyone says keep one pillow between the two knees. So instead of that, what you can do is you can just straighten the below leg. The forward leg you can bend and place it on the pillow like this. So in this position, what happens is the weight from the body, it will go to the knees, to the pillow, and then it will go down on the bed. So in this position, you won't feel much difficulty. And also if the pillow is long enough, what you can do is you can slightly extend it like this, and you can place it below the belly also. You can also use it for supporting the belly and also the breast. So this is how you can change your sleeping posture if you're finding difficulty in sleeping. Yes. So this is about the ergonomics and the sleeping posture which you can follow during pregnancy. So now let me get into some of the benefits of exercises during pregnancy. So a few benefits are we can avoid a lot of complications like hypertension and gestational diabetes mellitus by doing exercises during pregnancy. This is one of the benefits of doing exercise. And the next one is it improves sleep. So a lot of you might be facing difficulty in sleeping during pregnancy. So once you start doing your exercises, you will feel much more relaxed and also tired by the end of the day. So that will give you good sleep, and also it produces good hormones. So exercise always produces good hormones in your body, which will help in relaxing your body down and also improving your sleep. It also improves the circulation throughout the body, which is also very good for you during pregnancy. And also you will be worried thinking about the delivery, thinking about your pregnancy journey, and also what will happen once the baby comes. Your life is going to change. So all these things will definitely make you anxious and stress you out. So what you can do is once you start doing exercises, you will definitely see a noticeable change in your anxiety levels also. So that is one more thing, one more benefit of doing exercise. And then also it maintains a healthy weight gain. So instead of gaining a lot of kgs at a time, maybe in the duration or in the span of 1 month, you can slowly start gaining your weight. And exercise will definitely help in controlling your excessive weight gain. Okay, it will maintain your weight gain to an optimum level. And also coming to posture. So once you start doing your exercises, definitely during exercise, you need to maintain proper posture. So that definitely becomes a habit for you, and you start maintaining proper posture and you start correcting your posture also. It improves your fitness and flexibility also, and it increases your energy levels. So during delivery also we require a lot of breathing control and a lot of stamina, because labor might go on for a long period of time for few people. So what happens is if you're not doing exercise throughout your pregnancy, it might definitely make you feel very weak during labor or during delivery time. So if you've continuously been doing some sort of exercises or walking, you will have good breathing control and you will be able to manage the pain and cope up with the pain better, and you'll be able to have the stamina and endurance to go through the procedure of delivery. So that is also one thing, and also it improves your flexibility in the muscles and joints. So always when you are continuously stretching your muscles throughout your pregnancy, you're stretching your muscles, you're doing very good exercises, definitely you won't feel that tightness in your muscles, and we can also prevent a lot of pains and aches which happen during pregnancy. And also, as I told, to cope up with the delivery also, it will be very helpful because you won't feel that exhaustion. You will be able to manage the pain and have the pain tolerance also. So these are some of the benefits which help, which are the benefits of exercise during pregnancy. That is why always exercise is important to be done during pregnancy. So now coming to some of the guidelines which we need to follow. So when we say guidelines, the first thing is you need to get a green signal from your doctor. So if your doctor says that right now I've checked the scans and I've found that it's the right time for you to start your exercise. So mainly after anomaly scan, once you've done your anomaly scan, if everything is fine in the scan, no other complications, no other issues, doctor will give you a green signal for going forward or going ahead with the exercises. So at that point of time, you can start doing your exercises. So you can always consult your physiotherapist at the a specific unit and you can start the exercise. So maybe you can do a video consultation, or else you can come to the hospital and do a physical consultation and meet the physiotherapist for the exercises. So she will be guiding you regarding how to do. So for every person, it is not the same set of exercises. For every pregnancy, every delivery is different, right? And every body type is different, and each person's scan result will be different. So according to that, we will modify the exercises, and also we'll be teaching you some exercises to manage the pains and aches. So according to that, we will be providing or prescribing the exercises for you. So whatever exercise I'll be teaching you today will be a general set of exercises which can be done by everyone, but definitely for personalized assessment, diagnosis, and prescription of exercises, you need to definitely meet your consult physiotherapist for that. Okay, so coming to the scan. So once you see the scan, you will have to so doctor will be telling you to go for the exercises, then definitely you can start the exercises. But if doctor suggests you to go for bed rest, or maybe not to do any particular exercises, or not to do any harsh or rigorous activities, definitely do inform your physiotherapist also. And you can also keep in mind to not go for much of exercises during that period of time. So once again, when they repeat the scan, when everything is fine, then doctor gives you green signal, then you can go ahead for the exercises. So this is the first one main guideline which you need to keep in mind. The second one is about when to exactly do the exercise, regarding what time should we do the exercise. So everybody will be having this doubt regarding, should I do the exercise in the morning, afternoon, or evening, or night? So one thing which I can tell you is, so make sure that you're not doing the exercise on an empty stomach. So on empty stomach, I don't want you to do exercise or walking, because even when we are normally, when we are not pregnant also, when we start doing exercise on an empty stomach, we feel more tired and our energy levels are very low, right? So you have to always do the exercise after having something light, maybe. So whatever diet chart or whatever your dietitian has told or your doctor has told, according to that, you can just follow that diet, and whatever food item they have told for your morning, afternoon, evening, you can just have that, maybe some light snack like dry fruits, maybe a fruit, juice, milk, anything like that you can have, and you can do the exercise immediately, no problem. But when you're having full meals like breakfast, lunch, dinner, so we tend to eat a lot more than normal, right? So always what you have to do is wait for a while, maybe 1 hour or 1.5 hours, and then only you will start doing the exercises. Because some exercises, when we keep changing the position from one position to other, we might feel nauseous. So that is why never exercise on a full stomach. Wait for at least 1 hour or 1.5 hours. So if you want to walk, you can walk. Slow walk you can do immediately after eating. That is not a problem. But when you're exercising, you need to wait at least 1 hour or 1.5 hours before doing the exercises. So this is also one thing which you need to remember. And coming to drinking water, so whenever you're drinking water, make sure that you're not waiting until you finish the whole set of exercises to drink water. Make sure you start drinking water during the exercise, starting the exercise, and also at the end of the exercise session. So that is also very important. So don't wait till all the exercises are over to start drinking the water. So that is also one thing. And also make sure if you're walking or you're exercising, keep a bottle of water near you, so that maybe you're having profuse sweating, or you're feeling uncomfortable or tired, you can always keep sipping water throughout the exercises. And the next point is coming to, whenever you're doing exercises on the mat, on the floor, when you're doing the exercises, make sure that it is on a flat surface. So if the surface is bumpy, it can cause injury. So to prevent any kind of injury, make sure that you are always doing the exercise on a flat surface. That is also important. And also there is no spillage of water. Whenever walking and exercising, there is no spillage of water or any kind of liquid, especially if you're doing at home. So this also you have to remember, and don't exercise to the point of exhaustion. So make sure that if you're feeling tired, take breaks and continue the exercises. Don't keep pushing yourself a lot and then reach to the point of exhaustion to stop the exercises. Okay, so this also you have to make sure. And one more important thing is about what you're wearing. So you need to wear comfortable clothes, comfortable footwear, and also a good support bra whenever you're exercising. So if your clothes are ill-fitted or too tight, you will definitely not be able to do the exercises properly, not be able to maintain the posture properly because of your discomfort. So always wear comfortable clothing, comfortable footwear when you're walking, and also when you're traveling, going out, stepping out of your house, also make sure you're wearing comfortable clothing, comfortable footwear always, and always do the exercise on the flat surface. So I'll just repeat the guidelines for you once again. So the first thing is, you need to get a green signal from your doctor after your normally scan, and you can also, after the growth scan also, you can always come and consult the physiotherapist for modification of exercises, and also to improve the fitness session what they have given you. And coming to eating, so you need to always If you're eating full meals, you need to give at least 1 hour or 1.5 hours before doing the exercise. And water, you have to keep drinking throughout the session, starting of the session, during the session, and also at the end of the session, you need to drink water. And always do the activity on the floor. Keep changing the positions also very slowly. Don't keep exercising to the point of exhaustion, and wear comfortable clothing, comfortable footwear, and always make sure there is no spillage of water or any kind of liquid on the floor when you're doing the exercises or walking. Okay, so these are all the guidelines which I would like to give you. Now we will slowly move on to the exercise part of it. So again, I'll be calling Shweta to demonstrate the exercises for you. So firstly, before starting the exercise, let me just give you a few examples of some issues which most of the women experience during pregnancy. So the first thing is breathlessness. So a lot of us during pregnancy experience breathlessness because once the baby starts growing, so we have an accessory muscle called as diaphragm, which is helpful for respiration and breathing, right? So once the baby starts growing, baby starts slightly pushing onto the diaphragm, which causes restriction in breathing. So that is why most of the pregnant ladies experience breathlessness during pregnancy. So it is a very common symptom, nothing to be worried about, but we can do some exercises, some breathing exercises to help in the reduction of the breathlessness. So first exercise, I'll be teaching you 2 breathlessness exercises today, that is 2 breathing exercises. The first one is normal breathing technique. In this, what you need to do is inhale through the nose and exhale through the mouth slowly. So as you inhale, you can count 1, 2, 3, 4, 5. And as you exhale, again 1, 2, 3, 4, 5. Okay, so she will be demonstrating this exercise for us today. So inhale, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. So deeply inhale as much as possible and then slowly exhale out completely. So this is the first exercise, which is a normal breathing exercise, which we will be doing. The second breathing technique is the diaphragmatic breathing. So what you need to do is, you need to slightly place your both hands little above the waist. Okay, so when we are breathing, back. Yeah. So when we breathe in, normally when we breathe in, what happens is our chest expands, right? So as our chest expands, your hands should go behind, and as you exhale out, your hands should come forward. So inhale, again same way, inhale through nose and exhale through mouth. As you inhale, your hands should go back, stretch your body nicely, and then as you exhale, again come back to neutral. So inhale, hands back, exhale, hands forward. Okay, so like this you will be doing the diaphragmatic breathing. So again, in this you can also count 1, 2, 3, 4, 5 as you inhale, as you exhale again 1, 2, 3, 4, 5. Okay, so this is diaphragmatic breathing. So 2 breathing techniques I have taught you. First one is a normal, in which you need to inhale through the nose and exhale through the mouth. Okay, and the second one is a diaphragmatic breathing, in which you need to place your both hands little above the waist. As you inhale, as your chest expands, you need to get your hands back and then get it forward to neutral position. So these are the 2 breathing techniques which you can follow at home for your breathlessness if you are facing any kind of breathlessness. So the second exercise which we will be doing today is the neck stretches. So most of us are working also. So what you can do is, if you have any kind of neck stiffness, neck tightness, neck pain, which is always there after you finish working or during work because of your long period of work time, what you can do is you can do some neck stretches. Yes. So what you can do is, first neck stretches for your sides of the neck. So you can keep one hand on the shoulder, one hand on the head like this. Okay, you need to start pulling from both the sides. So you need to start pulling. So once you start feeling the stretch on your sides, what you have to do is, you need to hold it there for 5 counts. Okay, so you can count from 1 to 5. 1, 2, 3, 4, 5, and then you will relax and come back to the neutral position. So same thing you can repeat on the other side also. Keep one hand on the shoulder and start pulling from the shoulder also and even from the head. So you will start feeling a stretch on the other side. So hold for 5 counts and then repeat 5 times. So both the sides you need to do the neck stretches. So this is the first neck stretch, which is the side neck stretch. The second one is you need to look down as much as possible. Okay, and you need to start pulling your head down with one hand. So with one hand you can pull your head down. If not, with both the hands, you can use both the hands and pull your head down. So you start feeling a stretch at the back of your neck. So at that point of time, you need to hold for 5 counts. So again, count from 1 to 5 and then you will relax. Come back up. You will relax in this way. So this is the second neck stretch which you can do. The third neck stretch which you can do is you need to tilt your head to an angle. So you will look to an angle. No need to look completely to the right or left. Just look to an angle. Look down as much as possible. With one hand, you will start pulling your head down. Okay. So at that time also you will start feeling a stretch at your neck. So once you start feeling the stretch, again hold for 5 counts and then you will repeat 5 times. So this is how you will do the third neck stretch. Same way you need to repeat on the other side. So again, tilt your head and look down and pull your head down. Okay. So same way you will repeat on the other side also. So and then hold for 5 counts and repeat 5 times. So both the sides you need to do the neck stretch. Come back up. Yes. So neck stretches, we learned 3 neck stretches today. First one was the side neck stretch in which you will keep one hand on the shoulder, one hand like this, and you will start pulling, hold for 5 counts, repeat 5 times on both the sides. And the second neck stretch which we did was the front stretch. So you will look down as much as possible, pull your head down. That was the second one. Third one is tilting your head to an angle and looking down and pulling your head down, which has to be repeated on both the sides. So these were the neck stretches. Now coming to another issue which is faced during pregnancy, which is leg cramps. So most of you all experience leg cramps. 80% of women do experience leg cramps. So one good exercise for the leg cramps is heel raise exercise. So I'll be showing you today how to do the exercise. So what you have to do is turn towards the wall. Okay. Yeah. Turn towards the wall. You can just keep your hands on the wall for support and you need to just raise your heel up. Raise and then slowly come down. So slowly raise your heel up. Okay. And you will come down. Okay. So this is how you need to do the heel raise exercise. So this will definitely help your leg cramp. So once you start doing the exercise itself, you can feel the stretch on your calf muscle, and when you're regularly doing it, you will definitely see a reduction in the leg cramps. And also if you don't have leg cramps also, you can do this for preventing any leg cramps which can come during pregnancy. Okay. So this was the heel raise exercise. So what you need to do is slowly raise your heel up and slowly get your heel down. But whenever you're raising up and going down, don't just fall like this, causing bouncing movement. Just go up slowly and come down. Okay. So coming to the next exercise, which is called as squatting. So I think most of you all who have worked out before or have done exercise before know what is squatting, right? So usually we do air squats or the normal squats. So in pregnancy, that might be a little difficult, or for people who have not done squatting before, it might be a little difficult to maintain the posture, because in squatting, it's important to always keep the back straight and do the squats. So one good modification which we can do is the wall squats or the supported squats. So if you want to do the supported squats, you can make sure that there is any furniture like table or chair in front of you, and then just fold that and you can just squat down in this way. If you're not able to do that, you can always do wall squats, which I'll be showing you today. So what you need to do is rest your back completely against the wall. Keep your legs wide. Okay, so make sure that the feet is pointing outwards. Okay, So rest your back completely on the wall. You can maybe rest your hands on your thighs. So when you slide down, so what I want you to do is you need to slide down. When you slide down and come up, make sure that your back is always rested on the wall. Your back shouldn't be coming forward or away from the wall. So if your back is always rested on the wall, that will give you good back support and your posture will be maintained properly. So this is how you need to do the wall squats. So what you will do is you will keep the legs wide, feet pointing outwards. You can rest your hands on your thighs and you can just come down and go back up. Okay, so you have to just slide down and come back up. So this is a very good exercise for strengthening of the lower body and also for it can also be used as a good hip opening exercise. So which will also promote normal delivery. So this is called wall squats. So what you need to do is make sure that your legs are wide, your back is resting on the wall. You can keep your hands on your thighs or just relax your hands. Just slide down how much ever you can. So don't go too much down because you need to come back up also, right? So just go down how much ever you can and then come back up. So this is wall squats. So if you're comfortable with doing normal squats, you can go ahead with that also. Otherwise, you can go for the supported squats by holding some form of furniture like table or chair and you can do the squatting. So this is about wall squats. Now coming to Kegel's exercise. So Kegel's exercise, I think most of you must have heard, but I think will be confused regarding how exactly to do the Kegel's exercise. So Kegel's exercise is a very good exercise for some issues like pubic pain or urine leakage issues. So I think most of y'all will be experiencing urine leakage issues or maybe not having much control, not having much muscle control to control the urine. So maybe laughing, coughing, sneezing, you might have experienced 1 or 2 drops of leakage of urine. So one good way to prevent that or to reduce that is by doing your Kegel's exercise. So Kegel's exercise can be done anytime throughout the day, but make sure that your bladder isn't full when you're doing the Kegel's exercise. That's one thing which you need to remember. You need to always empty your bladder and then do the Kegel's exercise. So in Kegel's exercise, one good example which I can give you is you will have to start what you need to understand is, for example, whenever you're passing urine, if you want to stop the flow of urine, what you have to do is, what you usually do is, we just contract and hold the pelvic floor muscles or the vaginal muscles, right? So the same way, so if you want to stop the flow of urine, you just contract and hold the muscles. So same thing you will do, you will just contract and hold and relax, not while passing urine, while sitting, standing or lying down. So just contract your muscles, your vaginal muscles, you just contract and relax, contract, hold, relax. So first start practicing how to contract and relax. Once you get used to it, you can start holding for maybe 5 to 8 counts if you're comfortable with it. So this regularly doing Kegel's exercise will definitely help in improving the muscle control and it will help in strengthening the pelvic floor muscles. That will help in reducing the urine leakage issues and also any kind of pubic pain which you're having. So I'll repeat how to do Kegel's exercise once again. So for example, when we are passing urine, if you want to stop the flow of urine, we contract and hold, right? So same way, you need to contract and hold your pelvic floor muscles or the vaginal muscles not while passing urine, while sitting, lying or standing down. So Kegel's exercise can be done at any time during the day. So whenever you're working, when you're sitting, watching TV, anytime you can do the Kegel's exercise. So this can be done for the urine leakage issues which you are facing. So the next exercise which you'll be doing is the butterfly. So I want you to sit down. Yes. So in butterfly exercise, what you need to do is, you need to sit down normally, join your feet in the front like this, and you can hold your feet, okay? So instead of doing continuous flapping movement, just stretch nicely, try touching the floor and then coming back up and then again stretching and trying to touch the floor. Okay, so instead of doing continuous flapping movement, you can do in this way. This will help in your any kind of tightness which you're experiencing in the inner thigh or the groin area, you have any kind of pain, this will definitely help in reducing that. And it's also a very good hip opening exercise which promotes normal delivery. So this is the butterfly exercise in which you need to join your feet forward, hold the feet with your hands, and you can just stretch up and down and try to touch the mat. So if you are having maybe a larger tummy, okay, so you might feel the pressure when you're holding forward. So what you can do is you can always keep your hands back on the mat, okay, and you can do the stretching movement up and down. So this will not put much pressure on the lower abdominal area. This will be much comfortable for doing the butterfly exercise. So this is one modification which you can do. So this is butterfly. I hope you all have understood. So the next one is bridging exercise. So in bridging exercise, what you need to do is you need to lie down. So you need to lie down completely and you need to bend your knees. Bend both your knees. Keep hands to the side and you need to lift your hip up above the mat. So this is how you will do bridging. So this will help in strengthening your back. Any kind of back pain you are experiencing, especially your lower back pain, this will definitely help in reducing that. So this exercise called bridging, what you need to do is lie down, bend your knees, keep hands to the side, and you will slowly lift your hip up above the mat. So starting, when you just started doing the exercise, maybe you can just lift your hip up and then go down. Once you feel that has gotten a little easy, what you can do is you can lift up, hold for maybe 5 to 10 counts, how much you are comfortable with, and then you can go down. So you can repeat this around 10 times. So this is bridging exercise which is helpful for any kind of back pain. Okay, so coming to the next exercise which is called cat and camel exercise. So for people who've been doing yoga and doing any other form of exercises, going to gym, I think you must be familiar with cat and camel exercise. So this is a very good exercise again for the back pain. What you can do is you can go on a dog pose, a neutral dog pose you can go on. Okay, so make sure that your shoulder and hand is at a straight line and your hip and knee is at a straight line, and I don't want you to join your knees together. You can slightly keep it wide. Okay, so this is a neutral dog position. From there we will be starting. So when we say cat and camel, so how a camel's back will be, it will be hunchback, right? So same way you need to hunch your back. So what you have to do is you need to hunch your back and look down at your tummy. So when you start looking down at your tummy, automatically your back gets hunched. So this is the camel position. From here, you will arch your back, arch down, and you will look up. Okay, so you will arch and you will look up. So this is the cat position. So you have to alternate between cat and camel. So during pregnancy, you already have a arch which is formed, but so don't focus more on the cat position. You can focus more on the camel. Okay, so hunch your back and you will look down. So it will help in relaxing your back, and then arch your back and look up. So this is cat. So you have to alternate between these two movements. So the neutral position will be the dog pose. So this is the cat and camel exercise or the cat and camel stretch, which is again helpful for the back pain. Okay, so you can sit. Okay. Yeah. So the third exercise, the next exercise which we'll be doing is the lunges. So in lunges, what we need to do is we need to stand on the mat. Okay. Yeah. So you need to keep one leg forward. Okay. You need to keep one leg forward and you need to try touching the other knee on the floor. So if you're not able to touch the knee also, it's fine. At least you can go down and come back up. Okay, so you can keep, if you want, you can keep both hands on your hips and you can do it. Okay. Bend, touch and go up. Okay, so even if you're not touching your knees down on the mat, it's totally fine. At least just try bending and trying to touch the knee. That is also fine. Okay, so you can keep your hips, keep your hands at your hip. Okay, so you will do this, and also you can switch to the other leg. So other leg forward, and you will bend in this way, and you will come back. Okay, so this is how you will do the lunges. Okay, so I'll just go through all the exercises from the beginning. So the first one was the breathing exercise. So 2 breathing exercises I have taught. So first was the normal breathing. Second one was the diaphragmatic breathing, keeping both hands to the side and inhaling, hands back, and exhaling, hands forward. The second part of the exercises was the neck stretches, in which I taught 3 neck stretches. First one was the side neck stretch. Second one was looking down and pulling the head down. The third one was tilting your head to an angle, looking down and pulling the head down, repeated on both the sides. Then the next one which I showed you was a heel raise, which was helpful for the leg cramp. So just raising the heel up and coming down. The next one was the wall squat. So wall squats or supported squats. So supported squats, you can use any kind of furniture like table or chair or bed. For wall squats, you can use a wall, stand against the wall, and then just keep your leg wide, feet pointing outwards, and you will just rest your back on the wall and slide down. The next one was a Kegels exercise, which I told you. It is for the urine leakage issues or for any kind of pubic pain, and also the butterfly exercise, which I showed you sitting on the floor, in which you need to join the feet, and then you will have to slightly bring your legs up and down and stretching it nicely. So if you're feeling difficulty, you can keep your hands back and you can do the butterfly exercise. Coming to bridging, so you have to lie down on the floor, bend your knees, keep hands to the side, and you need to lift your hip up. So that is bridging exercise, which is again helpful for your back pain, and also the cat and camel, in which you need to hunch your back and arch your back. So cat will be arching, looking up. Camel will be hunching your back and looking down at your tummy. Then the last one which I showed you was the lunges, in which you need to keep your one leg in front of the other, and you need to bend and touch the other knee on the floor. Even if you're not touching the other knee on the floor, it's fine, but just try doing this exercise. It also requires a lot of balance. So make sure that something is there next to you wherever you are doing the exercise, so that you can hold and also lunge. If not, if you're comfortable with it, you can just keep your hands on the hips and also do the exercise. So these were the exercises, which are very general basic exercises, which I can show you right now. But for personalized exercise list or prescription, you will definitely have to meet your physiotherapist. She will be looking through your scans and she will be prescribing the exercises which is best for you. So now coming to, yeah, thank you so much, Rita. So coming to the red flags which you need to see for during exercise during pregnancy. So when we say about the red flags, so some things which you need to look out for when you're doing the exercise, so that you don't have any kind of risk of injury or any kind of complications. So the red flags, first one which I would be liking to tell is the chest pain. So any kind of chest pain if you are experiencing, or tightness in the chest, or any kind of shortness of breath or breathlessness if you're feeling during exercise, which normally was not happening. Okay, so suddenly one day when you're doing the exercise, you're feeling a little chest pain or shortness of breath, definitely you need to stop the exercise. The next one is any kind of bleeding, any kind of vaginal bleeding if you're seeing, you need to stop the exercise and also check with your doctor regarding that. And any pains, so maybe some muscle cramp you got during the exercise, so you don't have to push yourself, you can take a break for that day. Once you recover, you can again continue with the exercises. Any kind of abdominal pain, any pelvic pain, any persistent contraction, so you started feeling some contraction kind of pain or sensation, definitely stop the exercises. Any headache, or you're feeling feverish or profuse sweating, so normally when you do the exercise, you know how much you sweat. So more than that, you're sweating on one particular day, definitely stop the exercise. If you're already feeling decreased fetal movement, okay, so then also avoid doing exercises. If you're feeling faint, tired, exhausted, dizzy, lightheaded, nauseous, all these symptoms also, you have to avoid exercising. Hands and feet are feeling very cold, or maybe you have a lot of swelling, sudden swelling in the hands, feet, face, calf muscles, definitely stop doing exercises. And any kind of sudden gush of fluid through the vagina, if you're experiencing, also it can be an amniotic fluid leak. So even at that time, you need to stop doing the exercise. Or irregular or rapid heartbeat, if you have, even then you need to stop the exercises. And difficulty walking, maybe you've not been doing exercises regularly, so you have a lot of muscle soreness or muscle cramp or difficulty walking, so you don't have to push yourself a lot. You can take a break for a day, and then the next day you can continue with it. Any muscle weakness also, you can just inform your physiotherapist regarding that, and she will be giving you exercises which will be helping you with that. Okay, so these will be the red flags which you need to look out for whenever you're doing exercise. Any of these symptoms, if you're experiencing, definitely you have to avoid doing the exercise or continuing the exercises. So in today's session, these are all the things that we covered. So I told you about the posture and how to maintain the posture, and also I showed you one sleeping posture which you can follow, and also some benefits of doing exercise during pregnancy, and also what are the red flags, and some exercises I have taught you with the benefits of the exercises, and also what are the guidelines which you need to follow. Okay, so these are the things. So one more thing which you will be confused about is how many days do I need to do the exercise. So exercises can be done every day. You can take 1 day break for sure, but if you are doing exercise every day regularly, it's really good. But if you're not able to because of your packed schedule or because of some other issues, at least make sure that you're doing the exercise minimum 3 days in a week. Okay, if you're doing every day, that's really good. You can do it every day, but minimum 3 days in a week, you need to do the exercises. So these were all the things which I wanted to cover during this session. So I hope you have understood a lot of it. If you have any doubts, if you have any queries, you can always drop your questions. And also the whole guide of the video will be given in the description in the community. So you can definitely check it out once again. If you have any doubts regarding how to do the exercise, you can just go through the video once again. And also the feedback link is also mentioned below. You can also click onto that and you can give the feedback of this session. Any queries, any doubts, you can always drop your questions. And Dr. Vanilla, who is the physiotherapist of Chennai, she will be the answerer and she'll be answering your queries today. So it was really nice taking this session for all of you. So I hope you all have understood at least few of the exercises which I have taught you. So it was really nice taking this session. Thank you so much. Have a nice day.